Nasopharyngeal carcinoma is a tumor of the nasopharynx, so essentially behind the nose in front of the brain. Logistically, it is a very hard place to get to when you think of the fact that most solid tumors are treated with a component of surgery. Because it's sitting behind the nose and in front of the brain, you can't really surgically get to it. So the way that it's been historically treated is with high doses of radiation. They found that in kids, while high doses of radiation have been effective, the high doses of radiation are associated with a lot of long-term side effects. And so one of the things that the rare tumor group through the children's oncology group has done has been to see if you can add chemotherapy up front with the effort to be able to decrease radiation exposure long-term. The research project that was funded by CureSearch is a phase 2 feasibility study using Epstein-Barr virus-specific T cells for patients with nasopharyngeal carcinoma. Our group has done a lot of work using these EBV-specific T cells for patients that have NPC, much more so in a relapsed or refractory setting. And we found that in about half of patients that it's been really effective. But as has been discussed on multiple different occasions, it's really great if we can do it in a relapse refractory setting, but if we're able to do it up front and patients never have issues with relapse, then that's really the place that we'd like to be. But we've really done EBV-specific T cells at our own institution. And so right now what we want to see is if we can do it in a cooperative group setting, essentially bringing a boutique-type therapy to patients all across the country. So when we've evaluated what happens to our pediatric patients that have NPC using current treatment regimens, what we noted was that all of them have long-term side effects. Almost everybody is going to have issues with endocrine problems, have issues with dry mouth, have issues with pretty significant hearing problems. As a matter of fact, on the upfront study that was just completed, we're anticipating about 60% of children are going to have issues with long-term hearing loss. So our hope is that if we're able to use these virus-specific T cells as a form of maintenance therapy and can then safely decrease these radiation doses, that the long-term side effects that our children are having from the current therapy